RRT Posse, Big Money Bound, TV, YouTube. I need to talk to y'all, man. RRT Posse, I need to talk to y'all. What we represent, man?
Big Money Bound.
Say, let her know, man.
Big Money Bound.
Man. Last night, these folks had me in the ER. Soon as I get on, soon as I clock in, beep, I go up to my department, get report, go down to the ER. A patient comes in with respiratory distress. Patient already has a trach. Patient is being bagged by the paramedics. I get my ventilator. I got all my stuff in the room ready. I got my vent in the room ready. I'm finna hook the patient up to the vent. Doctor tell me, nah, she ain't ready. We gotta keep bagging her. What you mean? What you mean? I'm putting on the vent. Oh, no, she ain't ready. We got to bag her for a little bit. So I'm like, all right, go ahead and bag. He like, yeah, just bag her for like 10 to 5 minutes. We're going to come back in. Like, just breathe with her. Hold on, bro. You want me to sit here and bag a patient for 5 to 10 minutes? When we got a vent right here, you want me to do ambu ventilation? We can do ventilation? But you know what? It's the doc, man. That's the captain of the ship. You gotta follow the orders, even if they wild and silly. All right, cool, no problem. I'm bagging. I'm left for like 3 minutes, man. They getting blood, whatever. I'm like, man, what am I doing, bro? The nurse like, yeah, you don't want us to put the patient on the vent? He like, no, she not ready for the vent. Just keep bagging. He not ready for the vent. Keep bagging. Now I see he ordered an X-ray. See the X-ray person is outside of the door waiting. He like, yeah, let her in here. Let her in here so she can do the X-ray. So she can do the X-ray. We can get a picture of the patient's lungs and all that. I'm like, hey, I ain't finna be in here bagging while they doing an X-ray. I'm like, hey, I'm telling you, I'm not finna be in here bagging while they doing an X-ray. Oh, you can wear your lead vest, it'll be fine. Hey, I don't care what I'm wearing. I'm not finna be in here while they doing no X-ray, bro. You can be in, I can be in the Bentley truck with rims, with tents, with cupcakes in the back seat. I'm not finna be in here while they bagging no patient. I'm not finna be in here bagging no patient while they doing no X-ray, bro. I'm not doing that, man. When Jody Joe say she wants some little ones, I gotta be ready, cuz I'm not finna get no radiation finna hurt me, dog. Hey, I don't care what I got on, bro. I'm not doing it. Hey, write me up, cuz where you want me to sign my name at? First and last, bro. I'm not finna be bagging no patient while they doing no X-ray. I don't care about nothing, so. He was like, oh, I'll do it. Hey, go ahead, bro. You the doc. Go ahead and do it. I'm not finna be in that bagging no patient while they doing the X-ray. I don't care what I got on. That's just me personally, bro. I put them on this vent. They do the X-ray. I'll come back and I bag. But I ain't finna be here bagging while no radiation going on. RRT Posse, let me know. Am I wrong for that? Or does that kind of make sense? Would you be in there bagging a patient while they doing the X-ray? No matter what you got on. Would you be in there doing something like that? Let me know how y'all feel about it. Because me personally, bro, I can't do it. So, we bagging the lady. He finally said, all right, she looking a little better. Put her on the vent. Now, this lady breathing like, bro, 45, 50 breaths per minute. While she's comfortable, though. She's comfortable doing this. You try to give her, like, nice, deep breaths. Nah, I can't breathe. You got to go with her. That's how she breathing, nice and smooth. All right, so I set up my vent. The first mode we go to, PRBC. I'm like, nah, that ain't gonna work for her, man. She breathing so rapidly. I gotta go SIMV at a low rate. I put SIMV PRBC. Nah, she won't tolerate that either. I can't breathe. She's just fighting the machine. So I go to SIMV, pressure control, pressure support, and a low rate. Cool. She tolerating this fine, bro. She don't came around. She talking. She saying it's cold. It's hot in here. Can you make it cooler? Shorty good. She vibing. Okay, man, bro. I'm saying Randy from Respiratory Therapy. You know, I don't say it a day. The doc came back and was like, yeah, wow, man, she's doing much better. She's doing, it was a huge turnaround. She's doing great, man. Thank you for doing whatever you did. That's the ER doc. All right, cool. Man. About an hour later, the intensivist from the ICU comes down. I guess he looking at the numbers on the vent. When you got a patient that's breathing like they breathing with they on the vent, but they kind of doing their own thing, especially when it's SIMV mode. So when a vent is gonna deliver a breath, they exhaling the breath, they cutting the vent short. So it's gonna show delivered tidal volume is gonna be saying like 20, 30, 10, 5, crazy numbers. The next time it's gonna say like 450, 550. It's gonna even it out. But the overall minute volume was like 5.6, 6.5. It was a decent minute volume. Patient was sitting fine, doing good. Heart rate was normal. I guess he seen them numbers and he made some vent changes. I'm not in the room. I don't know what they doing, man. I'm at the other side of the ER taking care of some old business. They calling me saying, hey man, the doctor in here from the unit, he want to talk to you. He want to see respiratory. Alright, cool. What's happening, dog? I'm respiratory. What's going on? So I go in there. He like, yeah, I made some vent changes. I made some vent setting changes because she wasn't moving she wasn't getting a good tidal volume delivered on those settings. I got her on this. This is what she was before. This is what she was on before she came in. That's what she was on before she came in. But those same settings are the reason that got her here right now. But you the doc, I'm listening to you. Okay, cool. She seemed to be doing okay. As we kept talking, she was getting worse and worse. Nah, come here, dog. Hey, patient saying she can't breathe. She ain't tolerating this good. She ain't doing good. He like, okay. He got her on volume control, bro. He like, okay. Let me increase the, it ain't funny, because it's not funny. Let me increase the tidal volume. Dog brought the tidal volume up to 550. The damn patient, the patient is 5'1". 5'1". Patient 5'1", man. But she obese. She huge. The patient is huge though. You feel me? He's huge. It's a huge dude. 5'1", tidal volume of 550, 600. You can't do that, no, bro. I'm behind the dog, like, I'm behind him, like, what are you? But he the dog, but I'm like, hey, man. I'm like, whoa, bro, like, whoa. That's too much damn tidal volume for a little person. Yeah, she's obese, but height, you go by the height, not the width. The height is what determines the tidal volume. The damn peak pressure's alarm is screaming. Dog, like, can you fix that? Hey, no, I can't fix that. You got the tidal volume set. He said, bro, pump the alarm. Hey, doc, bro. Hey, man. So the nurse like, yeah. The nurse trying to get on my side. He like, hey, man, yeah. Whatever setting she was on before, she was tolerating it very fine. She was tolerating it good. Oh, no, but those settings were no good. No, those no good. Increase the peak. Bro, oxygenation was cool. Like, I ain't saying I'm the doctor. Oh, but I am the respiratory therapist. I know about this ventilator, man. I know about the respiratory lungs. I know about respiratory mechanics. Like, bro, that ain't the way you want to go, man. You add more pressure on you, bro. We finna pop something. Something finna pop. If you don't stop, something finna pop. If he don't stop, something finna pop, dog. So it got to the point where the patient was saying, no, get him out of here, But he the doc. So the doc was like, hey, you know what? Whatever you had her back on, whatever you had her on before, that was fine. When she get upstairs, I'll do what I want. Hey, cool, man. I changed some settings back so fast later. Oh, thank you. Hey, get them out of here, man. Get them out of here. Dog was saying, get them out of here, man. Bro. Hey, man. Bro. All I know is patient came in to tachypneic, shortness of breath, respiratory distress. I worked my magic on the vent. It was all good. Someone else came in there, turned some knobs. All hell had broke loose, man. And if he didn't stop, something would have popped. So I'm glad he knocked it off. But besides that, I had a cool night, man. It's just that the ER has gotten so big, man. They expanded the ER so much. You over here in room 2 doing something. They say, hey, man, come to room 94. Whoa, bro, I'm way over here in room 2. Hey, man, give me at least 15 minutes, dog. Give me at least 15. I'll be there in at least 15 minutes. So, this is the only thing, man. The ER is so big. And a lot of the older staff who normally love ER, they got some complaints about how big it's been with just one therapist down there. They got a point. And I understand where they're coming from, being like an older person. That is a lot of walking, man. I was in it like, man, this is a lot of walking. So just imagine somebody twice my age, 3 times my age. Feel me? So I understand where they're coming from. Right now, I'm on my way home, man. No Chick-fil-A today. Jody Joe finna take care of me, man. She at the house. Hopefully she up making breakfast. I asked her, please, babe, can you please make me some breakfast in the morning when I come home from work? Yeah, what do you want? What you want? What you want? I'll make it for you. That's what she told me. But we gonna find out if she really doing that, you feel me? I don't know. We gonna find out. Bro, I'm trying to explain to the doc, like, you feel me? Both of the doctors. Oh, no, I want you to keep bagging her. I want you to keep bagging her because she's breathing kind of rapidly. However the patient is breathing, I can finesse the vent to bend it to work in the patient's favor. However fast she's breathing, I can adjust the eye times and have that breath delivered so that she's breathing comfortably on the vent. You just gotta adjust some numbers, do some things. I can do it. Just, bro, let me put her on the vent. But when you work with a ventilator every day, that's your job. It's vents, 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 vents. And even though someone else is the doctor, but they don't deal with the vents as much as a respiratory therapist does, they may not understand what all I can do with the vent. And that's no knock on them. It's just saying that I'm more familiar with this machine because I'm doing it. That's my whole job, man. That's my whole 12 hours messing with these vents, doing something with the vents, setting up the vents, turning the vent knobs. That's what I do. That's my job. So I understand why he was saying what he was saying, but they need to understand why I'm saying what I'm saying. Which is why as soon as I put the patient on the vent, everything was all good. Bro, let me finesse the vent to cater to the patient's needs. Don't come in here looking at the buttons and numbers. Look at the patient. How she doing? How he doing? How they doing? If they good, then we all good. Come here touching my damn vent, man. Bro. Big Money Bound TV RT Posse. Joe to Joe, I'm hungry, baby. I am hungry.